All right, welcome. Today we are going to talk about something that millions, and I mean millions, of people have dealt with, but it's still kind of misunderstood. It's super common, can be really frustrating, but you know what? It's also totally treatable. So let's dive right in. So, to get started, I've got a question for you. When you hear fungal infection, what's the first thing that pops into your head? Well, what if I told you that the single most common one on the entire planet is something many of us have had or at least know someone who has? Any ideas?
Yep, you guessed it. We're talking about our feet. The most common of these infections is Tinea Pedis, but you probably know it by its more famous name, athlete's foot. And spoiler alert, you definitely do not have to be an athlete to get it. So, what is actually going on down there? In this first part, we're going to pull back the curtain and get into the science of what this thing really is.
Okay, let's get technical for just a second. Tinea pedis is an infection caused by a type of fungus called a dermatophyte. The easiest way to think about it is that these little fungi just love warm, moist, and dark places. So, yeah, the inside of a shoe is basically their dream home, especially if you live somewhere hot. And here they are, the main culprits. Think of these as the unwanted microscopic guests that have decided to set up camp on your skin. That first one, Trichophyton rubrum, he's the most common offender by far, but his buddies, T. interdigitale and Epidermophicus floccosum, definitely show up to the party too.
All right, so we know what it is, but the next logical question is, who gets it? Let's take a look at the risk factors because honestly, understanding this part is half the battle when it comes to prevention.
So if you look at the stats, yeah, Tinea pedis does tend to show up more in males and in younger adults. But, and this is a big but, this fungus is an equal opportunity infector. Your age, your gender, none of that gives you a free pass. Anyone can get it.
What's so interesting here is that it's all about the environment our feet live in. Occlusive footwear is just a fancy way of saying shoes that trap heat and moisture. Think heavy work boots or anything that isn't breathable. That creates the perfect breeding ground. Same goes for sweating a lot. And then, of course, other things like a weakened immune system, diabetes, or even just walking barefoot through the gym locker room can really up your chances. So, how do you even know if you have it? Let's talk about the signs, because Tinea pedis can actually show up in a few pretty different ways. Now, before we get into the specific types, here is a huge clinical clue. Tinea pedis is often asymmetrical. What that means is you could have a raging infection on one foot and the other one looks totally fine. That's a really key feature that helps tell it apart from other skin issues.
Okay, first up, we have the one everyone thinks of as athlete's foot. This is the interdigital type. It's that classic itchy, scaly, sometimes cracked skin you find right between your toes, especially between the fourth and fifth toe, where moisture just loves to get trapped.
Next, we've got the moccasin type, and this looks completely different. Instead of being between the toes, this is more of a dry, fine, kind of silvery scale that covers the whole sole and wraps around the sides of your foot, almost like you're wearing a moccasin. And fun fact, this is the one that's very often caused by that T. rubrum fungus we mentioned earlier. And last but not least, there's the vesiculo-bullish type. This one's easy to spot because it's all about blisters. You'll see these little clusters of small to medium-sized blisters, usually on the inner part of your foot, like on the instep.
So how does a doctor know for sure which one it is? Well, most of the time, they can tell just by looking at it. But to be 100% certain, especially if it's a weird case, they can do a really simple skin scraping and look at it under a microscope. That'll show the fungus plain as day.
And this table just lays it out so clearly. It really shows you the difference between Tinea pedis and other things like eczema or psoriasis. Remember that asymmetry we talked about? Well, eczema and psoriasis usually show up on both feet, symmetrically. And of course, the lab test for fungus is going to be positive for Tinea pedis and negative for the others. Simple as that. Okay, enough about the problem. Let's talk about the solution. This next part is all about what you can actually do to treat this thing and finally get some relief. The game plan for treatment is actually pretty straightforward. Step one is basic care. You have to create an environment where the fungus hates to live. That means keeping your feet super dry. For most people, the next step is a topical antifungal cream or spray from the pharmacy. If that doesn't knock it out, a doctor might prescribe an oral pill. And for that really tough, scaly moccasin type, they might add a special cream to help break down that thick skin so the medicine can get in there and do its job. You know, treating the infection you have now is great, but the real win is making sure it never comes back. So let's get into the final, and I'd argue most important section, prevention.
This prevention playbook is all about two things: moisture control and contamination control. It's about creating a dry environment on your feet with things like foot powder and a dry environment in your shoes by making sure they air out. At the same time, you've got to decontaminate the places the fungus could be hiding, like your shower floor and, yep, the inside of your shoes, to really break that cycle of getting it over and over again.
Now, if you've done everything right, followed all the steps, and this thing still keeps coming back, it's time to play detective. Where is it coming from? Could you be getting reinfected from your own shoes? Is there a sneaky, untreated nail infection that's acting as a reservoir? Or are you maybe just passing it back and forth with someone else in your house? And that really leaves us with one last crucial thought. It's so easy to focus all our attention on treating the skin on our feet. But that fungus can be living rent-free inside your favorite pair of sneakers, just waiting for the chance to come back. So I'll leave you with this question. You've treated your feet, but have you really dealt with your shoes?